My name is Vishakha Sahare and my topic is National AIDS Control Program. As we all know, AIDS was the most prevalent disease in India. That's why India has launched the National AIDS Control Program to control it. Under this topic, we will discuss introduction, phases of NACP, objectives of NACP, strategies of NACP, and National Strategic Plan for HIV or AIDS and sexually transmitted infection. Now introduction. The National AIDS Control Program, launched in 1992, was a comprehensive program for prevention and control of HIV or AIDS in India. Earlier the focus was raising awareness, but now it shifted to behavior changes, increased involvement of NGOs, universal treatment to all infected subjects aiming at reversal of HIV epidemic. Finally, the HIV-free India. Phases of NACP. The NACP was launched in four phases: NACP 1, NACP 2, NACP 3, and NACP 4. NACP 1 was launched in 1994 up to 1999, NACP 2 under the year 1999 to 2006, NACP 3 under the year 2007 to 2012, and NACP 4 under the year 2012 to 2017. Now we will discuss NACP 1. The first phase of NACP was started with the objective of slowing down the spread of HIV infection and reduce morbidity, mortality, and impact of AIDS in the country. NACO was set up to implement the project. It focused on awareness generation, setting up surveillance system to monitor HIV epidemic, and save blood transfusion. NACP2. The second project was initiated in 1999. It had two key objectives: to reduce the spread of HIV infection in India and to increase India's capacity to respond to HIV or AIDS on a long-term basis. Free antiretroviral treatment was started under the program in 2004. NACP3. The third phase was launched in 2007. The aim of halting and reversing the HIV epidemic over a 5-year period. Prevention efforts among high-risk groups as well as among general population were scaled up and integrated with care, support and treatment services at national, state and district level. As a result, HIV prevalence and death rates started declining. NACP4 launched in 2012 and its aim is to accelerating the reversal of HIV epidemic. Objectives of NACP4 are as under: reduce new HIV infection by 50% compared to that in 2007, taken as a baseline. Provide comprehensive care and support to all patients living with HIV and treatment services to all those who need it. The strategies of NACP4 are: intensifying and consolidating preventive services with focus on high-risk groups and vulnerable population, promoting and increasing the accessibility of comprehensive care, support, and treatment of patients living with HIV, expanding information, education, and communication services to high-risk groups and general population, building capacities at national, state, and district level, strengthening strategic information management systems. Some are the important data. In 2017, prevalence of HIV among adults under the age group 15 to 49 years was an estimated 0.2%. But even this translates into 2.1 million patients living with HIV because of India's large population. Between 2010 and 2017, new HIV infection declined by 27% and AIDS-related death fell by 56%. India's HIV epidemic is driven by sexually transmission, which accounts for 86% of all new infections. In India, Manipur, Mizoram, Nagaland has highest HIV prevalence state. National Strategic Plan for HIV and AIDS is launched in 2017 up to 2024. The main vision was paving the way for HIV-free India. Mission of this program is to attain universal coverage of HIV prevention and care, as well as continuation of services that are effective, inclusive, equitable, and adapted to the needs. Goal of this program is achieving zero new HIV infection, zero AIDS-related death, and zero discrimination of patients living with HIV. Objectives of this program: reduce new HIV infection by 80% by 2024, link 95% of estimated patients living HIV to services by 2024. Ensure ART initiation and retention of 90% of patients living with HIV for sustained viral suppression by 2024. Eliminate mother-to-child transmission of HIV. Eliminate HIV-related stigma and discrimination. Facilitate sustainable NECP services delivery by 2024. Now there are some questions as we learned earlier. In which year NECP was launched? So the answer is 1992. Second question, NECP2 was initiated in which year? The answer is 1999. Now third question, between 2010 and 2017, new HIV infection declined by 56%. The HIV prevalence state among following is Manipur, Mizoram, Nagaland. As we know that the most infected state is Manipur, Mizoram, Nagaland. So the answer is all of them. Thank you.